The role of the dominance behavioral system in anxiety and depression. Brandy Mora. Dominant and submissive behaviors are paramount to survival through access to the most desirable social and material resources. While psychopathological manic behaviors are associated with power and perception of power, anxious and depressed behaviors are linked to subordination, submissiveness, and power avoidance. Depression and anxiety have increased in prevalence in the last 20 to 30 years, with depression projected to become the second leading cause of disability by 2020 worldwide. General anxiety disorder affects about 7 million adults and can severely impact their quality of life. It comes on gradually at any time from childhood to middle age, with a lifetime prevalence of about 28%. While there are neurobiological theories and psychopharmacological remedies available, other behavioral aspects, like those associated with the dominance behavioral system, may provide insight for diagnosis and treatment. A review of the literature on the connection to DBS and psychopathology shows self-report, observational, and biological studies, as well as naturalistic and experimental paradigms, seem to support connections in both behavioral systems. DBS and its connection to depression and anxiety has proven reliable in self-measures such as the Submissive Behavioral Scale, Adapted Shame and Guilt Scale, Test of Self-Consciousness Affects Shame, and Attention to Social Comparison Information Scale. These measures often provide validity through the positive and negative correlations to shame, self-esteem, neuroticism, assertiveness, and leadership, with a focus on the connection between depression and subordination. In a naturalistic study conducted with 77 socially phobic outpatients from a psychotherapy clinic, researchers conducted detailed assessments using clinical and diagnostic interviews in combination with standardized questionnaires. The purpose of the study was to determine generalized subtypes connected to social phobia in relation to dimensions of love and dominance to help establish guidelines for future empirical studies. The researchers predicted these socially phobic outpatients would ultimately be classified into the two subtypes of friendly submissive or cold dominant. In a correlational survey design, 612 psychology students completed self-report questionnaires providing information regarding depressed and anxious behavior, as well as answering questions regarding DBS facets. They proved their hypothesis that multiple facets and characteristics of the DBS would be altered or distorted among participants reporting depressed or anxious symptoms. To establish research criteria and create themes, a qualitative approach using grounded theory might be used. Here, a specific depressed or anxious population are interviewed regarding their experience with power struggles. To support current research, a non-experimental correlational study might be conducted to compare DBS facets with depressed and anxious behavior. And using an explanatory sequential mix method, comparisons can be made and information gathered to support those findings. Self-report questionnaires would be conducted, and interviews would provide enrichment to those results. Because valid and reliable assessments for DBS facets exist, an explanatory sequential mixed method design where quantitative data is primary and supported by qualitative data would be meaningful in supporting the limited amount of research in this area. Survey and assessments have already been established for use in describing dominant and submissive behaviors, assessing a specific clinical population using these measures, and then further justifying the data through observation and/or interview would provide strong evidence for or against the theory. A mixed method design combines quantitative and qualitative research. Therefore, considerations beyond the typical ethical issues related to obtaining permissions, communicating the purposes for the study, avoiding deceptive practices, respecting vulnerable populations, and the disclosure of sensitive information is required. Specific to an explanatory design, researchers may use a large quantitative database for the initial phase of the research, and to follow up with a qualitative interview necessitates there be an identifier linked to the quantitative database. The DBS is conceptualized as a biologically, psychologically, and behavioral-based system which motivates our need for social and material power control. It is believed the human DBS system evolved from competition and the need to establish peace. Helping to determine the connections between anxious and depressed behaviors and subordination or submissiveness would help establish better behavioral modification and cognitive behavioral therapies for those diagnosed with anxiety and/or depression.